All right. Show of hands, how many of you have ever felt misunderstood or not understood in an appointment with a doctor about dry eye? Okay. This session is all about bridging the communication gaps so that we can feel better understood. And our first topic here is disease severity. Now, there's this classic situation I bet a lot of us have experienced. We walk into the doctor's office, and there is this immediate setup of my experience and my words versus their slit lamp. This competition, what they see, what I feel. When those two things do not match, we may not navigate that encounter super well. We may go away not feeling great unless something is done to explain what that gap is. So my question for all four of you is, what do we do about that? What are your best experiences and recommendations for how we can bridge the gap between my feelings and experience and your slit lamp? Both sides. This is what I want to hear. It's like, what would you, sorry, I'm not really being clear on the questions. So Natalie and Ben, as patients, if you have found pathways to get your voice heard and navigate that conversation, and then the two doctors, you've seen this and you've heard it from patients, how would you advise patients who are not feeling heard?
I think it's just really difficult because especially if you're new to the dry eye journey, you don't have a lot of awareness of the terminology, and the way the eye works. And so you're kind of going into this appointment and you're putting a lot of faith in this doctor, who is a dry eye specialist. And, I don't know about you guys, but when I was growing up, I felt like there was this idea that if you go to a doctor, you can trust that doctor, and I think, to be quite honest, throughout my journey, I've become a little disillusioned. I hate to say it. And there's some really wonderful doctors out there that do not fit into this category. And I never want to malign doctors because we desperately need them. There's wonderful, and the things that you guys have presented today have been so wonderful. But I think it's really difficult when you're just so overwhelmed. You're just trying to put your faith in this. You're trying to figure out how to communicate it with the terminology you have, and you don't understand the way the eye works. And so I know I've spoken about this before, but just self-education, learning as much as you can about the way the eye works and these conditions, starting to learn the terminology so you can kind of speak the same language, and that takes time. It takes it's not easy, it takes effort. I think a good doctor is one that can break that down and explain it to you and kind of, translate what they're saying to you. And there's some really wonderful doctors that are really good at that. But yeah, I think it's hard when there were many times where I feel like I didn't speak up when I wish I did in an appointment because I just felt like I shut down at a certain point. I felt like I wasn't being heard. And I see some of you nodding. I know you guys have experienced this and I hear about it. We see this on the Facebook groups a lot. It's such a common complaint of people saying, I went to my doctor, either I was really overwhelmed with the information they gave me, or I shut down because I felt like they weren't listening, or I just felt like I wasn't going to be believed. And so I think it can take a lot of understanding of the way dry eye works, trying to take notes into your appointments. I always take notes. Trying to really take the time to say, hey, can I really understand this? Start a dialogue. And then trying to convey as best as you can with maybe vivid, even graphic terminology. I always try to tell people that don't understand dry eye, I give them really graphic, it feels like something stabbing my eye, and using those terminologies, and I think trying to get them to understand, what could this be? And really kind of pushing. I think it's really good. I'm huge on advocation. I'm huge on pushing back and saying, please explain this to me. I don't understand this. I need to understand this in order to, we have to work together, and I think understanding it is a huge piece of that.
Awesome, thank you. Ben, anything you want to add on the patient side?
Sure. There's definitely much there that I agree with. I also think, in my experience, I haven't necessarily had doctors discount like my symptoms, like what the pain and discomfort I was feeling. There was maybe one or two, but there are other ways I feel like I'm going into an appointment with a doctor and I have to like sort of corral the doctor, to really understand whatever it is that I'm talking about. I think the things that have helped me are coming with empirical and specific like evidence or descriptions of whatever I want to talk about. So I would take a lot of photos of my eyes, so that if it turns out that the day that I'm going to see them, they look better, I can be like, look, this is how I woke up, yesterday or like last week or something like that, and like come with some clinical information from previous visits with doctors, or even like honestly sometimes, even though it's a little bit uncouth or impolitic to do this, mention what other doctors have said to you and kind of ask them to respond to this like contrary opinion that like you had heard previously. That has helped me because you're trying to tease out the truth from this like potential disagreement. I think as well, I record every appointment, and I ask in the beginning if I can record the appointment. I pull out my phone and just start the voice recording. When they invariably say yes, I haven't had a single doctor say no. Sometimes they're worried that I'm going to like sue them or sue some other doctor based on what they say, but I reassure them and I just say this is for my own for my own information. And I do think that changes a little bit the tenor of the conversation. And not in a way where I'm really like trying to push them up against the wall, but just, I have a record of what we talked about. And so that's just by habit, I do that, and it's been helpful, I think. But yeah, so to summarize, coming with whatever like empirical evidence of whatever you're going to talk about, be as specific as possible in your description, which I think Natalie spoke to as well. And then like I actually record each visit, and I don't shy away from bringing up the contrary opinions of other doctors that I think are confusing me while I'm talking to the person in front. And I'm facing this way, but I'm actually like talking to the two of you. This is just like, my approach as a patient, talking to doctors along my journey. Yeah.
Wow, I'm fascinated. So doctors, how do you feel if a patient says, can I record this? Have you had that happen?
I have no problem with. I think patients need to be their own advocates. I love it when they've seen one or two other people and they can tell me what they've been told, and we can talk about what I agree with, what I disagree with. I think medicine is an art, not a science. And I think that every patient is their own journey. And I think, I'm coming from a different way, that we're all trying to help in whatever tools we have. And some people look at things differently, but I think the ultimate goal is trying to help. The way I try to do it is I try to be as specific as possible. You have disease severity written there, but that can mean so many things to different people. So can treatment effect. And so I really try, even when we talk about disease, to be like, okay, this is what I see. Like I see a lot of scratchiness, or I see no scratchiness. I see a lot of X, so that it's not just severe, like severe what? Yeah. Like this is what I see, and this is what I want to try to target. Or even though I don't see a lot of changes, your symptoms are severe. And so then that's what we're going to target. I just think the goal, sometimes people leave when we use words like severe and the patient and the doctor interpret it differently, and the goals aren't set. So I want the goals, everyone has to have the same goal.
Yeah. I could have set that up better to explain what I mean. This is the classic situation that we hear about all the time is patient walks in, they undergo the exam, and the doctor says, actually you're looking pretty good. I see a little mild dry eye or a little mild blepharitis or something, and they think they're delivering good news to the patient. But if I'm severely symptomatic, that's just confusing to me, because to me, I'm severe. This thing is affecting my life. So it's, how we navigate that conversation.
I have patients ask if they can record, and I don't object to it, and I don't think it really changes what I have to say or how I interact. I think this is really a challenge because what the doctor thinks their job is versus what the patient is coming in and seeking might be two different things. And of course you don't know that when you first engage with a new doctor. And I think that with ocular surface disease, you have to find a doctor who wants to help you, which usually involves your talking and him or her or them listening, and some more coaching and talking after the exam. Most of us feel our job is, we can see what's wrong in a very quick exam. I said that before. And the norm now, 6 patients an hour in a medical ophthalmology practice, is that typical?
That's worse for you.
Yeah, well, it's not even for me because I've made my decisions, but in most private practices, I believe people are seeing 4 to 6 people an hour. Is that fair? They have staff recording things, lots of testing. They flip through the testing. They want to tell the patient what to do and get out the door. And they even have counselors who do the education, the prescription, and all of that. If that's the nature of the practice, that's not a place for you as a patient. If you have symptoms that have not been resolved by your prior encounters. I do think that when patients come in with lists and notes, that makes most ophthalmologists cringe. They're like, oh, here we go, okay? That's the sad truth. I try to review as much as I can. I now have a rule that I won't see new patients unless I get a note from their last visit. Doesn't have to be a letter. We don't have to put anyone out. Anybody's entitled. And I don't need all their records. I even like just the last note. I can tell a lot of things from one encounter. And when patients come in with pads that they're reading from, notes, or they have a list of questions, I like them to ask them, the staff does the intake. I ask them for the one thing they're hoping I'll address that day, the one thing, so they have to prioritize. And if they have a list of questions, I like to hear what all of them are before I do my slit lamp exam, because I need to know which things I'm going to be addressing when I review that with them. And I think one of the other secrets is to do follow-up at a close interval, not what most ophthalmologists want to do. They know it's a non-sight-threatening process, that the drug, whatever it is, might take 2 or 3 months to get the maximal effect. And so they prescribe something, see you in 3 months, out the door, my assistant will give you instructions. You can tell them what pharmacy and they're out the door. That's not good for ocular surface disease patients. You need to see them 3 or 4 weeks later so you can talk about all the things they're observing with the drops or with the intervention. And that's not so you have to find a doc who wants to do that. And I'm not sure. Unfortunately, the way our healthcare system is pressured right now, that's getting harder and harder to find. And if you have a restrictive insurance or live in an underserved community, it might be hard for you to find someone like that. But that really should be the goal. I think that hopefully you can get used to the doctor's approach and they can get used to you so that you can continue to have a dialogue, because it really is something that evolves over time.
I did want to add, I think it helps when I like your perspective on coming back sooner rather than later, because we were actually talking about this at our table about how well, first of all, a lot of us are stressed because we're trying to see these specialists and it takes so long to get an appointment with some of them. And then, so we're kind of anticipating it and we're stressed about it. And so when we go, it feels like this one shot, you're not going to see them again for 6 months. So you bring all your questions and your notes. And I know a lot of us feel like an anxiety about that. And so And so some of the times, I think that's why we're doing it. Also, the disease is really overwhelming and complex, and so we're just desperately like trying to understand. And so I think a lot of it's driven by just so much suffering and pain, and then the stress of not knowing when we're going to get these questions answered again. But I love like the idea of coming back, sooner, because I think if it's possible, scheduling wise, and I know there's a lot of complexities with this, like you were talking about with the healthcare system, because I've been in offices where it's like in and out like cattle, and it's just, and I'm literally sitting there and the doctor's walking out the door after my, looking at my eyes, and I've got like my list of questions, and I'm rattling them off like while they're leaving. And it just feels kind of like, it's frustration, I think, on a lot of fronts that I know a lot of providers are feeling too, because they want to spend more time with patients, but like there's obviously practicalities there, and then the patients are like, well, I need more time, this is complex, I'm overwhelmed. So I think there's this like constant tension, and it's really tough. And so I don't fully know what the answer is there, I think communities like the Facebook groups really help, because it gives people access to actually some wonderful doctors on those groups, other patient experts and things like kind of become their own experts. So I think things like that really help. But yeah, I think there's just a lot of tension and stress and so much anxiety when we come into those situations. And sometimes I think it comes out in like, neurotic behavior almost, if that makes sense.
I think every medical system is different. Like we have a communication system, so like UChart. So we always tell patients, like, I'm sure you're going to forget things. So the minute you remember, it's like an email system, but it's secure, and then it goes as part of your record. Have you found that that's useful? Because to me, that's super useful. No one ever gets all their questions answered in the first shot. And I feel like after I do a consultation, it's like a few emails back and forth, but they don't have to wait till the next time they see me. Have you found that that's useful or not really?
To be honest, I haven't actually used that feature with I've used it like with like fertility doctors and stuff, because a lot of that, you have the intense monitoring, things like that. I kind of wish that was something that was maybe more offered. I don't know how often like that's offered to people because sometimes I feel like you're annoying your doctor when you do that. Like there's like a sense in which
I'm on Kaiser, and in our system, I email back and forth with them.
And I think it's good, yeah. And I think that's a really great, continuing conversation to have, but I don't. But sometimes I feel like it's like not offered, and it feels like it's almost this thing that like it should be for emergencies. You know what I mean? Like it almost feels like it's touted as that.
Yeah, this is something I'm struggling with. I generally didn't and don't do email with patients, and I scheduled visits closer together. I allow them to help me decide what the intervals should be. The system I'm in now does have a portal, and I'm having trouble with inbox management, and I don't mind a quick query if there's basic confusion about how to take a med or something like that. But our system doesn't really have for a few years the messages were getting, it's a huge manpower and organizational issue, and I truly am burdened now by the anxious patients, and I say this sadly, but they are the people who are the most distressed. And I do things like I set up monthly appointments going forward. I add on to my schedule, but even so, some of these unhappy, suffering people can't help but second guess themselves and ask more questions. And I'm just now struggling with how to structure this and set limits, because it's wearing me out.
Can we have those conversations up front? Would that be helpful if we as patients are kind of, in that appointment saying, is there a possibility of any communication in between? If so, what would be helpful in there? Can I at least give you a little report of my symptoms, or can I pose questions? If so, should they be yes, no's? Can we get into it? Maybe just, is that a patient-by-patient thing? It's
going to vary with clinicians and locations, so I think that's probably a good idea. If a patient asks, sometimes with a new drug, they'll say, "Oh, I'll email, or I'll go on the portal and let you know whether or not it's working." I'll say, "Please don't. It's another message that I have to check," and the follow-up interval was designed so that I can deal with that. But this is very, very challenging, because there are more and more portals and patients who want or expect to have that kind of access. And it really is kind of breaking the system in primary care. I mean, fertility is interesting, but they're doing very high-risk treatment, and it's high dollar and it's profitable, and they have the manpower to back them up. I don't have that. I actually, this may sound awful and pecunious, you want to look that word up, but I like to deal with questions at follow-up visits because at least I get paid for my time. And it may be quickie follow-ups, and I do telephone consults, telemed phone visits, but I'm getting paid. And I think that all of the back and forth on portals and telephone calls is uncompensated time. And it's rare that doctors will do that. And I think you should negotiate it and expect that some limits might be set.
Right. Thank you all. All right, we're going to go to a...
Can I add something to that?
Yes, please.
So the situation in private practice has a lot of the same stressors. We are clinging to our paper charts, all right? And so probably a lot of younger people in this room have never been in an office with a paper chart, but when we start to see an examination and then we've got 3 or 4 phone notes and then an examination and then 3 or 4 phone notes, that's a trigger to us of 2 things. Number one is that exactly as was honestly acknowledged by Dr. Jacobs, this is a patient who is really beginning to burden our system, and that sounds horribly unfair to all the people in this room who have some of the profoundest suffering, but the reality is that there is just not nearly enough ophthalmologists, for sure, in this country to take care of the amount of folks that need to be taken care of. And we are being driven to the point where we have to say, who can I help? Okay, and am I the right person to help this person? And, you know, a really simple concept of measuring that is, how often is this patient calling between appointments? Because if they're calling a lot between appointments, then this is not a successful situation for the patient. The treatment that I'm recommending is not making them feel better. They have a tremendous number of questions, which a lot of it is unresolved anxiety over whether or not I, as an ophthalmologist, know what I'm doing and I'm guiding them down the right path. My general experience is that patients who are in a tough situation, if they are persuaded that I know what I'm doing, that I have a plan for them, maybe it's not an immediate solution, but it's a plan for them, and I 100% agree with this early follow-up. I do that all the time. They can sit tight and roll with the plan, but the fundamental belief has to be there, and if their fundamental belief is lacking, all the follow-up portal messages and phone calls in the world do not establish that fundamental belief. The other thing I love is if a patient who has a lot of anxiety about their situation and a lot of desperation brings somebody with them. Okay, I say the other set of ears. I'm delighted to have the other set of ears for a couple of reasons. Number one, they're another set of ears. But number two, I find that if they're sort of the support person for the patient in the first place, that it's calming for the patient, okay? They don't have to worry that they're so distraught after the appointment that they're not safe to drive because somebody else is driving. And that makes more information go in their head. So I'd say, bring your dry buddy, okay, and figure out quickly whether or not the practice is a good fit for you.
I love that, bringing the dry buddy. Thank you for bringing it up. All right, briefly, we're going to tackle the touchy topic here, the mental health thing. And this one, just in the interest of time, because I have a couple others I want to get to, I'm going to have this one just for patients. So, Ben and Natalie, is it ever okay for our eye doctors to talk to us about our mental health? We all know, right? Mental health is part of this journey, period. So, what does that mean to you in practice?
Yeah, I'm totally okay with it. It's absolutely part of the journey, and I can say that for me, this is featured not just in my appointments and conversations with dry eye specialists, but also the other kinds of doctors who I've had to encounter along the way. And I've actually kind of brought this up in some meetings, like during some appointments during my recovery after certain surgeries, being like, it's actually been really hard from a mental health perspective, or I didn't expect like this aspect, you know, to pop up in recovery, and like, you know, even just being on opioid painkillers and like spiraling as a result of that, or having, you know, anxiety as a result of that, and like needing to go on like a long walk to even just like clear my head a little bit, and that not helping. You know, I would like bring this up to some of my surgeons, and it either didn't get proper airtime in the, or acknowledgement in the appointment, or like they misattributed it to something else. You know, like I think I brought it up one time to a surgeon, and he said, yeah, you know, sometimes we see that as a result of the like steroids that we prescribe to limit inflammation, you know, after surgery. It could be that like the steroids were I think it was dexamethasone. The steroids were a factor, but then I forget if it was like being on the steroids or coming off them that he said can do that. But like, I think what I was experiencing was probably also would have been there regardless, right? So like misattributing that made me feel misunderstood, and I really think that like, insofar as doctors can at least acknowledge and validate the mental health aspects, it's like it really helps the patient feel safe. I don't think that's a controversial like thing to say, but I think it's worth affirming. And from a patient perspective, I absolutely think it's a relevant thing and to talk about, at least for me.
Yeah, I mean, I agree. I think I love it when somebody asks about my mental health. You know, I don't think we talk about it enough, honestly. And I understand that obviously, you know, you're going to an optometrist or an ophthalmologist, you're not going to a mental health specialist. And so we understand there's a limitation there, and, you know, and you can refer out and things like that. But yeah, I mean, so I was thinking the other day, I was racking my brain of how often I've been asked about my mental health in an eye appointment. And I kind of remember filling out a survey maybe once about that, but then it wasn't really talked about in the appointment. It was just kind of getting some data, which was nice to be asked, but I would have loved to talk about it a lot more and kind of explain how desperately I needed to feel better and how awful I felt, especially when I was experiencing suicidal ideation, extreme depression, and, you know, and anxiety. So I love that conversation. I think it's something that is definitely missing in some of the appointments, and I think if at the very least, if it's something where you could say, hey, like, I hear you, and I can refer out. Would you like me to do that or something? But yeah, I think it's something that is definitely lacking, because everyone that's had like moderate to severe dry eye understands the mental health implications can be just absolutely brutal. And so, yeah, it's really easy to feel like that is just kind of, you're kind of just like going in as like this clinical experiment to have your eye symptoms resolved, but we know there's also connections between, you know, pain and like stress and mental health. And so I feel like you really have to like address these clinical symptoms, but also the mental health component if you really want to get the full healing.
Awesome, thank you. All right. Dr. Galor, Dr. Jacobs, I'm going to put you on the spot here. Either of you have something like the most memorable thing you heard from a patient in this kind of community?
That's a tough one. I guess for me, it's a memorable concept. I don't know anyone who has chronic eye pain and doesn't have a mental health component. I just think that the first thing to know is that it's okay. It's like how your eyes are wired to your brain. And I totally agree. You just have to deal with both the eye and the brain. It's not easy, but we can't ignore the brain. And so I tell people right off the bat, like the first visit, like, you know, everyone has some emotional component, and many people feel suicidal. And I think that people appreciate that, because I think that if they're not plugged into a community, they sometimes feel like they're alone in feeling that. And whether it's good or bad, I think it's reassuring to know that they're not alone. And so for me, it's more like I don't always have the solutions, right? It's because it's hard. These are complex problems, but just starting with the right words of acknowledging the different aspects beyond just the eyes, that is, I think, the most important to me. So it's not one word, but it's kind of a concept.
I have one that was memorable because partly the patient's name was Deborah or Debbie, like my name. There are a million of us born in the late 50s. We're just crawling all over the face of the earth. And she was a wreck. First time I saw her sitting in the dark, weeping, and somehow I had recently become more attuned to pain syndromes, and particularly the use of pregabalin and duloxetine, which carry labeling for fibromyalgia, which historically has been a disease that some doctors didn't believe was real or didn't even exist. And I had one patient who had been put on duloxetine by a different doctor for her shoulder problem, which she thought was a shoulder problem. It was really fibromyalgia. And all of a sudden, her light sensitivity went away. So I logged that in, and then this Deborah came in, who I'd never met, and she was a wreck. And somewhere in her review of systems, it said that she had a diagnosis of fibromyalgia. That part was doing better. But I prescribed that drug for her, duloxetine, and she came back whenever it was, 2-3 weeks later. She came in and she was like, in her flip-flops and like a Hawaiian shirt, and she came and said, "Can I give you a hug?" She said, "I went to the beach." So that was, those were the words. I went to the beach. And in her, it really was like flipping a switch. It's not that way for everybody. It's not a magic drug. I was a good listener. I made a good choice. She was lucky. And in her case, it was really a tremendous thing. So it's not, I don't know why that, I'm a beach bum too. I like going to the beach. So when she could share that joy with me, that she was able to go to the beach just a couple weeks after her drug, and I know those of you who've spoken have talked about how you were so bogged down and then emerging, whether it's gradual or sudden. So so that was memorable for me about that drug. Other than that, mostly what I hear is that patients will say that that it's hard to find a doctor who actually listens to them. And I hear that over and over again. And I don't really know what the solution is. When I teach young doctors, when they rotate through with me, I teach them that. But that may not be a lesson they want to hear. The orthopedic surgeon didn't go to med school to hear about how you were feeling after. The steroids do cause all sorts of problems, but they would rather attribute it to something and leave the room, of course. It's much easier than having the conversation. So I don't know.
Thank you.
The beach, it's a good destination for all of us.
Awesome, yeah. All right, Ben and Natalie, briefly, something memorable you heard from a doctor along your journey. Could be good, bad, neutral, just something that stuck.
Yeah, so I remember when my eyes kind of got worse in 2014, I went to my local eye clinic, and I was just like, well, it says they're a dry eye specialist, I'll go there. I see this doctor, they look at my eyes, and I basically had a 0 tear breakup time, and they were very inflamed, very red, and had very clear telangiectasias, so super angry. And I remember him saying, well, your eyes look pretty good. And being wildly confused as to how he could label my condition good when I was like, I can barely keep my eyes open. My eyes are red. The whites are no longer white. How can this possibly be labeled as good? And being very confused by that. So that was pretty memorable. And that really kicked off my journey of trying to be kind of, honestly, just be like, well, I guess I better figure this out myself. So it was not the most positive, but it ended up kind of being positive because it kicked me off into that self-education.
It speaks right back to that mismatch of what they're seeing versus what I'm experiencing. Ben, anything to add here?
Sure, I'll share one bad and one good. So this was after I had gone to a bunch of dry eye specialists and kind of ascertained that it was probably because of the chronic exposure of the surface of my eye. And I was consulting with surgeons, and there was an oculoplastic surgeon who I consulted with in the DC area, actually, and explained to him my whole journey and experience, and what I thought the issue was, and he just, I think, didn't really believe me. Again, he's not a dry eye specialist, obviously, oculoplastic surgeon, but I think it's relevant. And he said, yeah, sure, I think he would have done ectropion surgery on me, which I also didn't, in hindsight, didn't really think was right. But he said, sure, I can do, ectropion surgery on you to boost your movie career. And I'm not an actor. And it just felt super dismissive. Here I am, desperate for a solution to my pain, and he thinks I just want a cosmetic enhancement. So that was probably the worst comments I've gotten from a doctor in a consultation. And then on the opposite end of the spectrum, I had a doctor who, after I had questions, after a small in-office procedure that we did, he gave me his personal phone number, and I was worried about being a burden to him. Kind of like we were talking about. I think it's a huge worry that patients have, and he actively reassured me that I was not. I get that can't always happen because there's an actual practical element of how many patients can I talk to, and how many questions in between visits can I field, but that made me feel a lot better, and I would have honestly understood if he put some limitations on that, and I opened the door for him to say this is too much, but he was let me know if you have any questions, that's what I'm here for. You're definitely not a burden, and I'll let you know if that changes. So that just cleared my mind of any guilt in reaching out and understanding that okay, if it's not working for him anymore, he'll let me know. So that was super helpful. Yeah.
All right. In the interest of time, because we're about to head into a break, just one last question. This one just for you, Natalie. The doctor that engaged best with you, what was different about the best doctor encounter you've had? What set them apart?
Okay, so I love a dry eye doctor who's super nerdy into dry eye. You can just tell they're just nerd out with you about it. And when you're there, you're just having this conversation, and they're you can just tell it their eyes light up, they're passionate, and when someone wants to talk about that, they're oh my gosh, yes, say more. And so I loved that because it felt like they were willing to have this conversation, and we could go, well, what do you think about this new eye drop coming out? Have you looked into that? Oh yeah, in this talk, and also just thinking outside the box. I love, I think this is great for any doctor, and you were saying, the idea of it being a science and an art, I think that's a really hard balance to strike, I would imagine. Obviously, I'm not a doctor for a reason, because it's a very, I think, complex profession, but I just love when doctors are willing to think outside the box. Obviously, I love it when they're data-driven and evidence-based and things like that, but I love when they can get a little creative, and when they can not think so black and white. I've really come to some doctors that are very black and white, and when you kind of think in a more nuanced way, I think just in general as people too, I think you get better outcomes, and you're able to coordinate care better.
All right, thank you so much, everybody. Really enjoyed that session. All right, we're going to head into coffee break for 20 minutes, and then we come back for what works from the patient perspective then.